Today we are going to talk about mental status assessment, and basically what is mental status assessment, um, and how do you do mental status assessment when you are assessing a patient who has mental health issues. First of all, mental status assessment is the assessment a medical profession or a medical doctor or a nurse do to a patient who has a mental problem. Number one, when doing mental state assessment, you start by first doing the general assessment, that is the general appearance of the patient, before you go ahead to check on other issues. The way the patient is groomed, the way the patient's hair, that is the head, the appearance of the skin, that is skin texture, check on the color of the clothes he is wearing or she is wearing. This will show you how the patient is. Mostly the patients with conditions such as schizophrenia, you may find out that the patient may have appearance that he is not well groomed. Patient with not with a schizophrenia may have a condition whereby he or she is wearing a cloth that is tattered, very dirty, and that is how you can assess the patient. Number two, we can assess a patient by going through the other issues such as checking on the attitude of the patient, that is a rapport or cooperation of the patient during the assessment. And also, you may refer to the patient's approach to the interview process and quality of information obtained during the assessment. That is how the attitude of the patient is now assessed. Number three, you also check on the behavior of the patient. How is the patient behaving? How is the patient responding to the environment that you have given him or her? You can check on how basically the patient responds to your questions. Is he behaving normally? Is he the abnormalities of the behavior, also called abnormalities of activity? Good observation of the specific abnormal movements as well as more general observation of the patient level of activity and arousal. So that is what we check on when you talk about the behavior. We check the patient may have a tremor or dystonia, or may indicate a neurological condition on the side of effects of antipsychotic medications. That is the behavior of the patient. We find out the patient bangs his head on the wall. That's one condition that shows you that the patient is behaving abnormally, and that is may detect a condition whereby a patient is suffering from this condition called mania. That is, a patient is hyper. Or major depressive condition, whereby the patient is very harsh on you. It also called the autism condition, whereby the patient cannot they have autism, Also akinesia or chupa. Those are conditions that you may see with the behavior. You can check on the speech of the patient. How is speech? How is he speaking? His thought process, is the thought process no, sorry, the speech, how is he speaking? Is it spontaneous? Is it paralinguistic? How is the phonation? Yeah, you look at it and you will realize that the patient may decide to go high. You see the voice of the patient. You're talking to him silently in a way that he is supposed to respond very slowly or in a low tone, but the patient phonation now goes high, but he speaks in a loud voice. That is very, very important. And that is very important to assess that. Mood, how is the mood of the patient? You assess on is described using the patient's own words. Like you can say describing somebody terms such as neutral, euthymic, dysphoric, euphoric, angry, anxious, or pathetic. Is the patient pathetic? Alexithymic. Individual may unable to describe their subjective mood state. An individual who is unable to experience any pleasure may be suffering from anhedonia. This is a condition who is unable to experience any pleasure. That is, any pleasure with anything. Is an pleasure like you can have. That is where somebody is having pleasure through sex or anything else, but the patient is having no pleasure. You can arouse him, but he is feeling no pleasure. That is an hedonia condition. Also talk about affect. This affect is apparently the emotion conveyed by the person's nonverbal behavior. The anxious, the sad, and etc. And also by using the parameters of appropriateness, intensity, range, and activity and mobility of the patient. Is he mobile? Is he not mobile? That is it. Sorry, my screen is not showing well, but I hope you'll cooperate with me as I talk about this. Talk about insight of the patient. When you're concluding, you just talk about the insight of the patient. Firstly, talk about the thought process, the thought content. The thought content is what he speaks. How is he speaking? How is it taking you? Is it in a process form? That is the thought process. Is it talking about something fast or is talking about something? Then many ideas come when he's talking. The thought content is he having a lot of information at the same time? Is he talking about something else, then coming with something else? That is thought content and thought process. As I conclude, talk about the insight of the patient, talk about the person understanding his or her mental illness is evaluated by exploring his or her explanatory account of the problem. Understanding of the treatment options. Like you can say, now the patient is there with you. You ask him, why? Do you know why you are in this mental institute or mental uh, clinic? He or she will tell you about why he is there. Like, I'm here because of drug induced psychosis, and I'm here for treatment. Or he is saying, that I don't know why I'm here, and I don't know why they brought me here, because I'm not sick. And when you analyze, you'll find out that he or she is sick. That is very important when you're assessing the inside of the patient. And also talk about the medication he's taking. Is he taking some of the medications? Is he fully aware of why he's taking the medication? Very important when you're assessing that. And also judgment of the patient. When you're concluding, talk about the judgment. When you talk about judgment, is he able to judge a situation? Like you can ask him about him or her, about a situation whereby like a fire now has taken, there is a fire in the house and there is a baby and there is money. Then you ask him or her what he or she will rescue first. Then you realize that this patient will say, I rescue money instead of rescuing the baby. That is very important when you're assessing the condition. Thank you so much for today. Then tomorrow I'll upload something else on mental health. Thank you and have a good day.